Thanks to all of you for having me here. I really appreciate it. Thank you, Dr. D and NP Lamo and the board for organizing this and working so collaboratively together to represent nurses so well across this great province. I am the daughter of a nurse. My grandma went to nursing college, but the war started and she had to leave this career. So my mom stepped into that legacy. I always called her bossy, but now that I'm, raise your hand if you're a little bit bossy. Yeah, now that I'm also a bit bossy, I call it leadership. And I think there's a lot of leadership in the RNAO over the course of 100 years. Unfortunately, my mom was squeezed out of the profession because of workplace conditions. And we know that that mentorship is something that we really need to hold on to. And I know that she would have been a good mentor to many of the other nurses. She was in labor and delivery. And this job to her was a calling. She grieved missing Christmas and Easter and birthdays, but she knew she had a duty to her patients and her team at the hospital. I really respect that nursing is really a combination. It's a career where you have to be very skilled and talented, but you have to care deeply, and those things have to go hand in hand. And it does make the job hard. As a social worker, I know that you leave your job, but you don't always leave what happened that day, that you carry those stories and those situations with you. And I know the situation we're facing with the drug crisis, the escalation of homelessness, our aging population, that is something that I hope you take care of yourselves now more than ever, because it is important that you put your mask on first. Yeah, put your mask on first. So I do want you to pat yourself on the back, because the job you do is so important, and sometimes I'm sure you don't always give yourself enough credit for the wonderful work that you do. So we do have a lot to celebrate. This government is investing in new hospitals. They're listening and expanding the role of nurse practitioners and team-based care and spaces for nursing students. So I know there's a lot to look forward to and be hopeful for. But I do appreciate also that RNAO is being a strong voice to push for more, especially when it comes to evidence-based practice and harm reduction. The social determinants of health. We know that healthcare isn't just at the doctor's office and emergency rooms. It is in the fabric of the foundation of how well people can live their lives and addressing poverty. We know that inequity in Canada is at an all-time low, that our rich are getting richer and our poor are getting poorer. So I appreciate that you speak up beyond the clinical setting for the well-being of all people, whether you're in long-term care, hospitals, public health, community nursing, and beyond, that you're really looking at what patients bring in with them every day and advocating for better. And I also am grateful that you can say the words climate action and understand that how we treat our planet and how our health are inextricably intertwined, that we need, thank you. We know that without green things and spaces, without clean air, without healthy food, that we will not have a healthy population. And it takes a lot of courage in this political climate and in this media climate to really stand up and stand strong for things like diversity, equity, and inclusion, harm reduction, and climate action. So thank you for that courage. I really appreciate it. And I'm glad to see all of our parties here representing our parties, that we want to work across party lines, and we see the investment you make and the value that you have to protect and save our public healthcare sector. So thank you so much. Keep being disruptive forces. Keep being good leaders and a little bit bossy. Thank you for your courage and your wisdom and your expertise. And I want to I don't know, I feel bad getting you to come up here again, but Mike Schreiner has an apology letter because he couldn't be here tonight, and he knows better than to miss that 2 years in a row. He's in Windsor, so sorry for that. We were like...
So Windsor is better than us.
I know. I will give him back for you. Trust me, he left me with quite the job to do today, so he's in the doghouse for me too. But we do have a certificate to congratulate you on 100 amazing years of nursing in Ontario. Thank you.